And I'm going to brag on you too and say that you have had people who've had problem surgeries with other places that have come to you to fix them and make them better too.
Yeah, in the past month I've done 6 to 7 redos, which for a community guy is very high. Most people do that in a year.
And so come to you first, and then they won't have to have a redo, right?
Yeah, hopefully that's the plan.
And the other point is, if you're going to have a hip or knee replacement, it's better because general orthopedists, meaning people who are not fellowship trained, often do hip and knee replacements. And probably most of them in the country are done by people who have not undergone the specialty training that Dr. Kemker has. I have done hip and knee replacements and did not have the specialty training that Dr. Kemker has. The chances of a complication are greater if a general orthopedist does the procedure, or the chances of it lasting perhaps as long may be not as high unless you go to somebody who has specialty training. And even if the person who's generally a general orthopedically trained does your work, and he does a great job, there's a fixed percentage that don't last forever. They fail. For whatever reason. It could be a doctor factor, or it could be a patient factor. Regardless of the reason why a surgery doesn't meet the anticipated result, it's better to have your surgery done by the person who's trained to deal with the complication.
Absolutely.
If you're not able to deal with the complication, then don't go to that specialist.
And that's why I don't do hand anymore.
And that's why I don't do hips and knees anymore. If during a surgery a nerve gets lacerated when I remove a tumor from a hand, I can borrow a nerve from part of the arm and patch that nerve, and I can repair that nerve, and I have a microscope that I can bring in and sew it together with sutures that you can't simply see with your eyes. You need a big, powerful microscope to even see the sutures or the needles that I use to sew it on. I can deal with my complications that I see
And I want no part
surgery.
of that.
But
I cannot
you can do
deal
yours.
with right, but I cannot deal with the complications of the esoteric pathology that he's been taking care of.
Right.